Medicare just released numbers for 2024, and the big question that we hope to try and answer for you today are the potential costs higher for you if you get a Medicare supplement plan or more if you get a Medicare Advantage plan. I do need to give a few assumptions here because there are so many variables that come into this discussion. So if you want to know the assumptions I'm using, keep watching here. If you don't care about the assumptions and want to dive straight into the dollars, there are chapters along the bottom here where you can skip to the juicy parts. Okay, your costs will come in the form of premiums, which are the monthly dollars you need to pay just to have coverage, whether you use the healthcare system or not. Your out-of-pocket dollars will also come in the form of copays and coinsurance, which are your payment responsibilities when you do actually use the healthcare system. We're going to use averages of several surrounding states for these numbers, so plans and costs available to you may be higher or lower depending on where you live. Remember, Medicare is not a one-size-fits-all decision. Now, your costs will also vary dramatically depending on how you decide to fill in the gaps left by original Medicare. These are not your only two options, but they are the two most common options nationally, which are a Medicare supplement plan, specifically a Plan G, and a Medicare Advantage plan. So this video is going to go over the costs and compare these two options for you. Lastly, this is a cost comparison, not an ease of use comparison. Do not make your Medicare decisions on a YouTube video, including this one. Sit down with an agent and go through the full list of pros and cons of these two plans and others, which we cover in other videos on this channel. Okay, hello to those of you who skipped to this point. Let's get this going. We have to start with Original Medicare, which is Part A and Part B. These are the same, regardless of whether or not you choose to go with a supplement plan or an Advantage plan, sort of. Part A is your hospital coverage, and according to the Centers for Medicare and Medicaid Services, or CMS, 99% of Americans have $0 premiums for Part A. This is because you or your spouse have contributed to the Medicare system for at least 40 quarters, which is the equivalent of 10 years, through your life, so you do not have a Part A premium. Part B does have a monthly premium, and in 2024, the base Part B premium is $174.70 per person per month, or $2,098.80 per year. I'm going to round these to $175 and $2,100. Hopefully that is okay with everybody as we move forward. It will make math just a little bit easier, but know that there are a few pennies here and there that are different. I say the base premium because Part B premiums are based on your income from 2 years prior. So if you had a higher modified adjusted gross income, meaning higher than $103,000, if you file your taxes as a single filer, or $206,000 if you file your taxes jointly, you will pay more per month for your Part B premium. It is called your Medicare Income-Related Monthly Adjustment Amount, or IRMA, and here are the numbers for you. On the left are the income brackets, depending on whether you file individually or jointly with a spouse. Wherever your income falls, move across to the right, and you will see what your Part B monthly premium would be per person in 2024. All right, those are your costs for Original Medicare, but Original Medicare leaves substantial gaps that most people cover with one of the two plans that we've mentioned, a supplement plan or an Advantage plan. Just to have the coverage of a supplement plan, you need to pay a monthly premium. This is highly dependent on where you live, and the average for a Plan G across our 5 surrounding states is about $150 per person per month, or $1,800 per year. If you get a supplement plan, you will need to pay this premium regardless of whether or not you have any medical costs. For an Advantage plan, it is a much different story. According to the Kaiser Family Foundation, 73% of Americans with an Advantage plan have $0 premiums, meaning they do not pay money every month to have the plan. To try and compare as close to apples as possible, we're going to look at drug coverage, dental, and vision because many people want and need these coverages. Just know that none of those are required, but we need to look at all of them to give a fair look at the costs for most people. Let's look at prescription drug coverage, which is Part D. If you go the supplement plan route, supplement plans do not cover prescription drug coverage, so you would need to purchase drug coverage separately. According to CMS, the average premium in 2024 will be $55.50 per month, or $666 per year. Again, this is per person, and I'm going to round this to $55 and $660 to make up for those previous penny bumps, and to make things easier. It is an average, so there are plans much lower and there are plans much higher than this. Advantage plans typically have Part D included in your already $0 premium. In fact, that 73% figure I mentioned earlier was specifically around plans that include prescription drug coverage. Similar story with dental. If you want dental coverage, supplement plans do not cover what you'd normally think of as dental coverage. You would need to buy a dental plan separately from your supplement plan. In our area, separate dental plans are about $40 per person per month or $480 per year. Most Advantage plans have at least basic dental included at no extra charge. The amount of dental coverage varies a lot by area and by plan. Some are quite basic, others are quite rich. Finally, vision matches the same narrative here, where you would need to purchase a vision plan separately if you went the supplement plan route and you wanted to get one. You're looking at about $15 per person per month or $180 per year. Basic vision is typically included with Advantage plans at no extra cost. So now we can look at our total fixed costs for Medicare, depending on which plan we choose. Fixed meaning you will need to come up with these dollars even if you never once got sick in a given year and you never used any form of healthcare. Remember that with the exception of people on Medicaid, everyone has the Part B premium, so don't forget to add that in. With a supplement plan, you are looking at about $435 per person per month in premiums, or $5,220 per year. With an Advantage plan, you have the Part B premium of $174.70 per month or $2,100 per year. There are Advantage plans that offer a Part B buyback to lower that further, but those are the exceptions, not the rule, and we're going to stick with more of the rule for this video. Now, if we were to stop this conversation right here, the dramatic difference in fixed costs would persuade everyone to choose an Advantage plan. And for a large number of people across the country, this is enough. They are choosing Advantage plans based solely on the fixed cost savings and not having to pay for something they don't use, plus the extra perks that come included with the plan. But we are not stopping this video right here, and this is not the end of the conversation. We have to talk to you about variable costs. These are costs that you would see if you ever do need to use the healthcare system. The first variable cost to go over would be the deductibles. A deductible is the dollar amount that you need to pay first before insurance starts to pay anything. With a supplement plan G in 2024, you have a $240 annual deductible. Once you pay that, your supplement plan G will kick in. Most Advantage plans do not have a medical deductible and coverage starts immediately. Some do have deductibles, but again, we're going with the more common plans available, not the exceptions. After your deductible is met, you may run into copays and coinsurance. Well, with a supplement plan G, you don't have copays and coinsurance, which is why Plan G is the most popular supplement plan choice nationwide. With an Advantage plan, you do have copays and coinsurance responsibilities for most services that you would seek out. These dollar amounts will vary by plan and will show the more important number in a minute. Excess charges would be the money that you are responsible to pay if you visit an out-of-network doctor or hospital. With a supplement plan G, these are covered and you don't have excess charges unless you visit a provider that is completely opted out of Medicare. With an Advantage plan, you are confined to a network of doctors and hospitals. If you go outside that network, you are responsible for either a higher dollar amount or 100% of the cost of using that doctor or facility. When we talk about an out-of-pocket maximum, it does not apply to Supplement Plan G. You pay your deductible and then Plan G takes care of the rest for Medicare-approved procedures and services that you receive at any facility or provider that hasn't completely opted out of Medicare. With an Advantage plan, you will pay those copays and coinsurance dollars up to an out-of-pocket max. In our area, the average is about $5,200 for in-network services as an out-of-pocket max. There are areas of the country that are lower than this with plans with a max out-of-pocket of $500. There are areas of the country that are higher than this. If you go out of network, the numbers are much higher as well. Now, your out-of-pocket maximum is the maximum risk that you would face on this plan as long as you are visiting in-network providers with approved charges. The out-of-pocket max is much harder to hit than what you may be used to on a high deductible plan. A deductible and out-of-pocket max are not the same thing. Okay, when we pull down the total cost sharing numbers, we see a considerable discrepancy. $240 per year for a supplement plan G, $5,200 per year or more if you go out of network for an Advantage plan. And if this was the only part of the conversation we focus on, the discrepancy between the two is so large that everybody would choose supplement plans. There are 3 asterisks that we need to talk about, and we touched on them before, but they need more clarification, and that would be drug coverage, dental, and vision. None of these, other than the premiums, are included in these out-of-pocket max numbers or copays or coinsurance numbers. They are handled separately. I can't speak too much on dental and vision because the variability is just too much nationwide, but how Part D prescription drug coverage is handled is more or less standardized. Drug coverage has its own deductible, its own copays, its own coinsurance, and for the first time in 2024, there's a quasi out-of-pocket max for prescription drug coverage, which is right around $3,300 for the year if you're on brand-only medications. And this dollar figure is the same whether you go with a supplement plan, with a standalone Part D drug plan, or if you go with an Advantage plan, the difference being in the monthly premiums with the supplement plan versus the no-cost inclusion in an Advantage plan. Now, the vast majority of people do not hit their maximum out of pocket, both with Advantage plans and the drug plans. We're talking about single-digit percentages, so as you're looking at these high dollar amounts, we are referring to your maximum risk, the highest dollar amounts you could be looking at if you had a catastrophic year. On the other end, we also look at a perfect year where nothing goes wrong. What is the reality? For most, it's somewhere in between, leaning slightly towards the lower end. Okay, let's look at the total risk with the supplement plan G together with a drug plan versus an Advantage plan with drug coverage. The total annual risk with a supplement plan G for a good year where nothing goes wrong is the number that we had, $5,220. However, if you had a bad year where everything goes wrong and you need 2, 3, 100 surgeries and very high cost medications, your annual cost is around $5,460 for the medical. Throw in the additional $3,300 to meet your max out of pocket for your drug costs. With an Advantage plan, if you have a good year where nothing goes wrong, you're looking at $2,100 per year, which is just your Part B premiums. However, if you have a bad year where a lot goes wrong and you hit your max out of pocket, you're looking at $7,300 in that year. When you throw in drug coverage of that additional $3,300, that comes into play into that equation as well. If your illness is very expensive and it covers multiple years, for example, it starts in September and then it spans into the next year, you're looking at your max out of pocket for 2024, and then it resets again in January of 2025 as well. So just something to consider. So in a good year, you could save about $3,120 per year in this scenario by going with an Advantage plan. You could take that money and you could set it aside in an account for potential bad future years. But in a bad year, you could have saved as much as $1,840 per year on a supplement plan G. And if you're thinking, well, look, I'm healthy, I'll just get an Advantage plan, and if something bad comes along, I'll just switch to a supplement plan. Unfortunately, in most states, it's not that simple. I have a video again right up here if you want the details around switching between these two plans. This video was strictly about dollars and cents, but there are several other important differences between an Advantage plan and a supplement plan that you will want to know before you make your decision. We've dedicated an entire video to that topic that you can find here. Lots of changes are coming. We have several videos that we are releasing over the next few days and weeks addressing the 2024 changes. Subscribe if you'd like to see those. My email is in the description of this video if you have Medicare questions. Great job making it this far, and I will see you in the next video.